In this conference, we are trying to discuss about the system that we are developing, and I believe this is a great forum to receive some kind of feedback, and it's a great pleasure for us to be here. As you mentioned, my name is Alexandre Lobo. I'm called here as Alex, and I'm from USJ Macau, and we have some international cooperation to develop this solution. Today I'm presenting here the platform that we call SmartCST, which is a platform for stress coping and the aim of reduction, right, for patients under social risk and more exposed, right, submitted to chronic stress. I'm going to explain the history behind this platform, this research that we are developing, and who is this group of people that we are doing the intervention, and what kind of technology we are using for trying to give them tools to cope with stress and reduce it in the most important goal, right? Okay, let me click here. Okay, yeah. So we have this research is a result of a cooperation between several institutions. Actually, I put here more than the researcher are the institution that we are doing some research together. And basically, my host institution is the University of St. Joseph, but I'm also connected. I'm a visiting associate professor at the Chinese Academy of Science unit in Shenzhen called SIAT. And IPREDI is the Institute of First Infancy. It's one institution in Brazil, right? So the general idea here was a cooperation between, I'm Brazilian originally, and we've been always doing some cooperation, some joint research with Brazilian institutions. And a few years ago, we started one very close connection with IPREDI, this institute here, which is one institute focused on helping, providing support to families in very critical social conditions. In the beginning, IPREDI was one, like a nutrition focus, right? A focus on hunger. And then with the maturity of the institution, they started to develop more support, like psychological, medical, and many other dimensions. And then recently, in our joint effort, we are trying to put lots of science inside the institute, and I'm bringing some from my area, right? Some expertise in brain devices and software as well. So my research was basically, originally I'm from the bioengineering area, and I started my research with a strong focus on the heart, not only the ECG, but then after doing a lot of research with the ECG, the heart beat and the heart characteristics, right? The electric behavior of the heart. Then we started to study several different applications using heart rate variability, which I believe some of the participants here may already been working with, which is one reflection in the heart from two main modulation systems from the autonomous nervous systems, which is the sympathetic and the parasympathetic subsystems, right? So they interact all the time, trying to achieve a kind of dynamic balance, right? Not the entire balance. And this focus on the balance may create lots of possibilities of analyzing, trying to modulate these systems with our control and how to use how to develop tools to modulate this contribution or this balance or this fight, as you may want to say. So from the heart rate variability, we started to get more and more attention directly to the brain monitoring. And that's what happened when we started doing some research with EEG, basically, and some other brain analysis, like images as well. But we tried to keep, since we were doing like time series analysis with the heart rate, we tried to start using our previous tools that we developed to see which one would be suitable to start using with the EEG. And that's what we have done a few years ago. And we started a strong research focus on brain-computer interfaces. This type of brain-computer interfaces we've been using not only for monitoring, like we can see in these pictures here, but also for action, right? So for trying to map some kind of brain signals, as many other systems are doing, but with very specific focus. I'll talk a bit more a few slides ahead about the type of devices that we are using here, because this is part of our core definition for the research. We had also the opportunity to work with some other types of interactions, like robotics and brain devices. And we had a few experience before with some sensors, like intra-brain sensors, that we've been trying to develop some nonlinear analysis in the signal. So I bring here some risks about brain monitoring systems that I want to highlight, because this is part of our daily challenges in our research, right? So when we try to think a lot about brain-computer interfaces or brain devices or brain monitoring systems, we tend to think a lot about the device, right? We tend to think a lot about the software. But we have other risks that impact significantly in our research. And I put here a list so we can, every time we want to develop some kind of research in this field, we bring these topics for the discussion, right? For example, right, I brought a list here: cognitive and communicative impairment, inappropriate expectations. This is something that we deal a lot. Even in this research, we had some, and when I say inappropriate expectations, not only from the participants, right, from the subjects, but also from the research teams, right? Usually this kind of research with BCI, we bring people from several different areas as a multidisciplinary research, usually, and together health and technology, the expectations needs to be very clearly aligned, right? And another thing is the group vulnerability. That's what we studied a lot in this research. Affective impairment, privacy and security. This is something critical for our research. We are dealing with patients, right? So privacy and security is something that is one of the main aspects that we deal with, and identity disruption, right? So when we started studying this brain-computer interface, those brain monitoring systems, we started to get a lot of attention, particularly from my team, in the aspect of relaxation, right? What is the impact of relaxation, and how do you cope, right? How can you use what I said before, right? The EEG or the heart rate variability to help, and what is the impact of using these, developing some mechanisms to develop relaxation levels, better relaxation or higher relaxation levels, right? So the area of studying the meditation, right? And relaxation techniques has been widely studied in the literature. I put here a few researchers from our colleagues, and we see a lot of things, or for example, I just put here things really 1, 2, 3 papers using FMRI, right? And some other using EEG and neuroimaging. So, of course, FMRI is one of our core assumptions for the research that we developed. Is we use FMRI results as a ground truth, right? It's a very controlled environment. It's a very reliable equipment, right? So we can clearly see in fMRI images what is going on inside the brain, right? This is something fantastic. But our core objective is not to use fMRI, right? We want to use simple devices, simple equipment that we can install in any kind of setup, and we don't need to have a high cost or a difficult process to execute the intervention or the training session or whatever we can call it, right? So here in USJ, with this core of research that we've been developing, we recently created one new lab, the Laboratory of Applied Neuroscience. This is one lab, this is one photo of part of our campus, and we can see our lab is one of those yellow cubes that you can see there. Right? The lab, the idea is to be, we call it applied neuroscience because the lab is a unit to provide applied research on neuroscience for several different areas. Our university is more focused on humanities, social science, and we are providing in our lab a kind of framework, equipment, and technology to support research on business administration, education, psychology, and so on. Right? And the idea is to be this multidisciplinary environment that we can provide. We can integrate, right, those ideas and start creating our history, right, and reputation on the field. So there is a brief timeline here. I'm not going on details here, but we started in 2017 here in Macau. Of course, my research started 20 years ago, but we've been doing this here in Macau since 2017, and we've been doing a timeline with some different research projects. I'm going to talk a bit more about it ahead. So we have lots of active cooperation, and in this area of the lab, we have researchers going on with Brazil, with the United States, with Boston University. This one with Boston University is focused on neuromarketing. We have active cooperation with Portugal as well, and we are here based in Macau, China. So as I mentioned, right, brain devices or brain monitoring are challenging devices because of their complexity and because of their the possible level of noise, right, that we can achieve in some of these devices, right? So our one of our first core decisions was to avoid using very complex devices. Of course, we lose, right, some aspects of reliability, right, or some aspects of quality of signal, but that's one of our core things, right? Identify devices that we can work with, and they have simple setup, and they have simple operation, right? So we started using the emotive device. I think many people here already use. It's a very nice interface and is a reliable device until certain level. Oh, so another important thing. What we are doing here in many different researches, when we are trying to use these simplified devices or less complex devices, we are not targeting directly to have diagnosis, right? We are not trying to use as a diagnostic supporting system. Right? What we are trying to do is to measure the brain activity and according to the literature, following the guidelines that we already have a scientific foundation, and then we are using for some clinical intervention, but not as a full computerized diagnostic support system. Okay. So we started using one very interesting device that we identified here in Shenzhen, here in South China, which is the BrainLink. It's one, as you can see from these figures, is one EEG focus on only on the forehead. We have devices with different numbers of sensors, and we started using it in 2018, and it was a great surprise for us. The electrodes are dry. We don't need to have time to set up and with gel or water, and we've been doing this analysis. We started using this device a few years ago. So after we defined the type of device that we wanted to use, we started doing some research here. I put here a list of projects that we've been doing with the Faculty of Business Administration. We're doing something related to promotional videos. There is one very nice research from one of the MBA students, but she is originally from health area. So it was a very productive study in decision-making under stress. Maybe we can bring this one in the next conference. And we have the others related to branding, casinos. Well, casinos, as you may know, is a core part of the economy in Macau, and that's why we are studying that. And then more technically, we are working with AI classifiers and chatbots as well. And other areas we've been doing, we started one study with ADHD children, neuro leadership, cooperation and competition. But we have, I put here the highlight in the one that we are presenting now, our system that is focused on mothers and children submitted or exposed to chronic stress, basically because of their social conditions. So this is just a few examples of some data collections that we've been running here with the EEG and some other physiological monitoring tools like the heart rate, and it's a reality. Another thing that we are developing here is the integration of these brain devices with external devices, right? This is one robot, one spider robot, and this is another one, right? And these devices we control with the brain signal. Well, actually, it's not a very fine-tuned control. It's just a level, you achieve a certain level of attention, and then you send the signal through the Bluetooth that the system here has, and we can make the robot walk, move, turn. It's an ongoing area. Of course, this one is more simplified. We can only walk, but we are doing different integration with other devices as well. So this picture was from one fair in Brazil that we took the devices with the spider robots, we created a kind of race here. And the idea was to, this was an uncontrolled environment. We were just checking reaction, right? Verifying reaction, and what did they use to achieve the certain level of concentration of focus that made the spider walk, right? And you can see here different strategies, right? People very focused. Some of them were trying to close their eyes. Some of them very stressed because they couldn't make the spider walk, right? So this aspect of metacognition or understanding some aspects of the cognitive aspect or the cognitive side of the concentration process is something that is one of our key interests in our research. In addition, we are using here this lamp. The lamp is the opposite of the spider. We control the color of the lamp. It's a multicolor lamp according to your level of relaxation. So besides the EEG, we've been doing what we're trying to do recently, since 2020, was to expand the monitoring to multiple technologies, right? So we have the EEG and different possibilities. We have the emotive here, we have the brain link, we have some other, as you're going to see, we have medical EEGs as well that we use in this research. And we have other biometrics solutions like heart rate, galvanic skin response. We are using also some eye tracking devices. We have three possibilities of eye tracking. We are using one infrared table eye tracking integrated with the laptop. We have one eye tracking glasses. This is a very nice solution that you can have like real-time monitoring in a real setup, people walking and monitoring the eye movement. And we have also one that we are developing directly with the webcam, right? Another possibility that we are using is the facial coding. The facial coding is monitor facial expressions to classify emotions, basically, right? But besides emotion, we can go through other measures such as engagement or attention level. And so in the research that I mentioned before about stress and decision making, we used all of these in parallel, right? And we also have a module for self-report, right, which is a model that the user, I put here in this figure, we have consumers, right? But the participant can be the patient, has a tool to self-report, right? So you can monitor the accuracy, right, of the participants' responses with the biometrics. So moving to our solution, right? So our SmartCST software is an integration between biofeedback, including EEG and heart rate variability, and some statistical analysis, data analysis, data science, and artificial intelligence. So I already mentioned a bit about the IPRED, our institute in Brazil that we are working with. It's a fantastic institute. They provide support to more than 1,000 families. And basically, these families belong to a very low income part of the society, and they don't have anywhere to go. They don't have access. Sometimes they don't even have access to health institutions. And IPRED is a kind of open door for these families. And they work not only with the children, because it's first infancy, right? But this was the focus until the beginning of the 2000s, right? The institute exists for more than 40 years. And they started focusing also on the mothers, right? These families in Brazil, usually the father is not present, right? So it's a family that was already suffered a kind of break, and the father is usually not. Of course, we receive families with both parents, right? But the mother is a key aspect to keep this family together, and that's why IPRED today has a very strong emphasis on supporting the mothers. And that's why this research that we developed consider not only the children, but children and mothers. FUNCAP was the foundation that provided our funding. We needed funding for equipment, scholarships, and some clinical tests that we developed. Right? So this is just one brief slide about chronic stress. I'm not going to spend a lot of time here. I think everybody is aware about the long-term stress, that what it may cause. And I put here one figure about the research design before I present the solution. This figure is in Portuguese, but I think you can understand there are very similar words to English, right? So the research is divided in 3 phases. So we have one pre-intervention, that we had a kind of anamnesis, one neuropsychological evaluation, and then we have a clinical marker here that we use that is very famous dealing with stress, which is the cortisol level, and we use the hair to measure cortisol. That gives us a time span, right? After doing this first phase with the mothers and children, we started doing the execution itself, which is the intervention, right? And then we divided 5 groups here. One only doing using EEG, second one using heart rate variability, a third group using both, and we have one placebo group and a control group, right? The idea is to give a very extensive possibility of analysis. We can compare here if both EEG, heart rate variability together is more effective than only one of them, right? That was the idea. And then after the intervention, we have the conclusion, right? So we run again the evaluation, and we run again the cortisol tests, right? So we have 4 months execution, and the cortisol, according to our lab, they give us a precision of, well, it depends on how long is the hair, but we have something around 3 months, right? So with that, we had our system modeling, right, which is the solution that we are presenting here. We have as input our clinical marker, right, the cortisol. We have our training sessions that we model together with the psychology team. And we have, in this first phase and the last phase, one analysis with clinical EEG, right? The neuropsychological analysis. We also run the quantitative EEG. So the idea is that our system generate reports, do some kind of clustering with our participants, right? And run a possibility of having some kind of alarms or supporting technology for the team, right? There's not only one professional. We have the pediatrician, we have psychologists, we have nutrition team, we have well, the technical team, right? And the IT taking care of the software side, and these kind of alarms, they give us support for this integrated operation. So basically, we have our QEEG here that we run the QEEG only in the first and third phase. Okay, it's a kind of time-consuming. We need to think like that. These patients, they are very challenging, right? The participants. Why? Because they are trying to survive every day, right? Because of hunger, because of stress in their communities, right? And it's very hard to bring them to the institution just to have one participation in our research, right? So this challenge we started overcoming with some motivation, even financial support, and we try to keep the daily session as simple as possible. So we run the QEEG in the beginning, we run the QEEG in the end. We have the cortisol here in the beginning and in the end. And during our intervention, we have the brain device for the EEG, and we have the heart rate variability device for the other group. Okay. So the challenge, technical part, right, was to develop our own software, right? We have our own solution that we monitor these devices, and we put everything in a database, and then we run our data analysis module. So we have our modules here. We have the patient, and we have 3 modules. I'm going to explain them: RAS, PS, RMS in details. Yeah, we have the 3 subsystems here, right? So RAS is relaxation activities, PS is what we call perception subsystem, and RMS is the results monitoring. Right, so let's go individually. The RAS that we call relaxation activity subsystem is how did we design the sequence of activities that the mothers and children were submitted to, right? So basically, we started using some available apps that are already integrated with the brain device. This is for the intervention, okay? For the QEEG, for example, we use the standard software that they use for the data collection. In this case, we use in different sessions, different apps for monitoring the state, and not only monitoring, but training, right? It's an intervention. So what we have is a neurofeedback system where we monitor. It's like a gamified environment, right? You have a game, one app that is a game, and the avatar will only move if you are relaxed, or you have a very famous, I put here 4 examples. We have the very famous Zen Garden, where you create a garden according to your level of meditation, right? I like a lot the Mind Ant as well. It's a very well gamified solution that you need to focus and you need to relax to make the game goes around. And then we designed this, and the challenge was the data integration, right? So we run a level of our own software to collect this data for future use. The other subsystem that we call this the perception subsystem, right? This is basically the level that we needed to develop to integrate the devices with the software. Well, so we have the 2 main dimensions, right? The EEG and the heart rate variability software. So we have a fully developed by our own team HRV analysis system. So we have variables in the time domain, frequency domain, geometric domain, so many possibilities. And we are also doing some additional analysis like entropy, nonlinear analysis. And from the set of variables that we monitor, right, we have our RMS. our RMS as the results monitoring subsystem, which I think is a core of our contribution here. So the idea is we collect the data, right, from the perception subsystem, and then we need to run several statistical analysis, right, graphical reports, and then the idea is to have all the data integrated in a cloud database, and we generate what we call individual dashboards and our smart reports. The individual dashboard, we show performance, right? What happened during one session, what happened during the entire number of sessions. And the smart report is we use what we measure and we try to give insights, right? So this is a second level that we are validating now, our set of smart reports. The smart report is not only for alarms, right? We can have a smart report for alarms when we need to be aware of be cautious about some harmful situation, or right when the patient cannot really relax in one entire session. This is a kind of automatic alarm, right? But what we're trying to do in our smart report is to also use artificial intelligence to get some insights, right? What we cannot directly see. And this is very nice doing comparison between different sessions of the same subject. In this case, the approach is very clinical, right? It's very hard to compare subjects. Of course, we have the demographics that we can consider. We used lots of demographics. One of the first steps on phase 1 is the first interview. Usually, actually, since we are doing this in IPRED, we already have a kind of very clear demographics of the participants, right? But if you want to use the same methodology in another type of institution, that's what we are planning to do in other places or here in China as well. We need to have a moment, right? A moment in phase 1, the beginning of the research, that we collect very important data. We also run the perceived stress test, right, which is a self-assessment of the participant. Right? For the kids, we run it through the pediatrician. For the mothers, they have done themselves. But you can imagine the challenge. Some of the mothers couldn't even read, right? So we needed to guide them through the research. Well, so from the RMS, I put here a few slides with some of the data analysis that we've been doing. We are running some statistical measures here, like the box plot as a very valuable analysis of part of the session. This you can see here on the top is one entire session. We have here what we call the attention level, and we divided the session in 3 parts. These parts, according to our plan of activities, we run different statistical analysis for each one of them. For example, you can see this one here. There was an increase in the attention level and a less dispersion, right? And for the third part of the session, you see that there was a significant decrease here, right? So the idea is to, we don't have like video recording of the session, right? One idea for the future is to use the same experiment that we are doing, the same framework that we developed, to also record the session, and even maybe with the recording, do the facial expression analysis and detect some kind of emotion. The same thing we have done for the attention, we have for the relaxation levels. And this, after that, we move directly to the artificial intelligence. This is a general figure about possibilities of classifiers, right? This is not our software. I just use one general figure here, so to give an overview. So after we collect the data, we calculate many. We have more than 100 metrics that we calculate from the signals, and we move these metrics to our software classifier, right? So we have an artificial intelligence system that inside the classifier, we implemented lots of different algorithms from machine learning, from deep learning, and some supervised, non-supervised algorithms. So our idea is to make our classifier or clustering technique unsupervised in the beginning until we get more knowledge about the data. And we are getting interesting results with differentiation of types of groups and classes. And the idea is to go further with more data collection and improve the classifier. So our next steps will be, as I mentioned, we are trying to develop lots of different biometric systems. We are trying to use FMRIs now as a quite expensive device still, but this is one of our core areas. We have a bit of problem with electrical signals, right? But the EEG is a kind of gold standard, right? But we are trying to expand to other very promising areas like the microbiome, right? With some clinical analysis, and also DNA, genetics, right? Epigenetics area, and together with some more lab testing, right? So this will be a more comprehensive research. We are trying to apply for funding for this new step. And just to highlight here, besides our lab here in Macau, we are developing with IPREDI in Brazil one plan to have one research center running there that will support not only IPREDI but other institutions that are focused on low-income families. And there is one key interest on robotics devices and some brain control prostheses, right? So I finished my presentation here. Thank you so much.